It's true though. I mean, a lot of people literally don't know what they're doing the alcohol tax for, just by some, and some of it's.
But that's not what this is about. Yeah, okay, everybody, welcome. It's 11:02 a.m. Today is May 10th. It's Friday, 2024. We're scheduled from 11 to 1 alcohol tax strategic plan work session. So I'm just going to dive right into that. Anna, go ahead.
Okay, yeah, thank you, everybody. And we are going to be doing, a few things today around alcohol tax. Sorry. Not only are we going to give an update on the project to create an alcohol tax strategic plan, but we're also going to give an overview of the communications work that has happened the last couple years to help educate the public and put the information out there about where the tax money has been spent so far. And so you'll see that on the screen, the cheers to you. We'll get to that in just a second. And I will go through my talking points that hopefully staff have prepared for me. So there are 3 assembly sponsors of this project, the Alcohol Tax Strategic Plan, as well as a lot of work that happens primarily with our staff around the communications work. So the assembly sponsors are myself, Member Bronga, and Member Voland. I know Member Voland is out of state right now, and Member Rogan here and I have been, we're picking up the charge today. So this plan was really a priority since it was funded last year in 2023. And actually, I think funded before both of us were on the assembly. But there's multiple things that we want to accomplish with this plan. One is to make sure that we're responsive to the public about the tax that voters approved. So we make sure we have that positive feedback loop because as you all know, the tax was dedicated to specific purposes. So we want to make sure that we are communicating back to the public that their tax dollars are being used wisely.
I made a mistake. Dove right in without introductions for the record. Mr. Martinez, sorry.
George Martinez. Mark Littlefield.
Karen Bronga.
Zach Johnson.
Anna Brawley.
Christopher Constant on the phone. Mr. Salt.
Randy Salt here.
Thank you, Mr. Rivera.
Present.
Anyone else on the phone? Okay, and then we have several folks from community organizations who will be introduced later. Sorry, Anna, go ahead.
Yeah, so part of what we need to do is be responsive to the public, make sure that we're communicating back how this money is being used, and ideally achieving the outcomes that we want and the community wants. We want to also produce a framework and guidelines for evaluating and deciding how we use the funding going forward. So as you all know, it is part of our budgeting process. It is a dedicated fund. It has certain uses, but every year there is a conversation about, do we continue funding what's been funded? What can we fund new? And so we want to have a step back after these first few years of implementation and have a big picture conversation about how we want to approach that going forward. And then we also want to identify lessons learned. As I said, this tax was implemented in 2021. And of course, it was during COVID. It was a tumultuous time. And so, we should be happy that we have been able to fund a lot of great work over the last few years. But I think there's a lot of room for improvement. And that's not only on kind of how we decide where the tax funding should go, but also the administration of the tax through grants and so on. So what you'll see in the plan that we'll get to later is really some of those lessons learned, areas for improvement, and recommendations of how to do that, which of course the Assembly would work with the administration to implement, because we are not the ones who put the grant money out there, but we want to make sure, again, that we have that positive feedback loop, that the things that the community identifies as priorities and then the things that we fund are actually getting out in the community. So those are more operational, as I said, but this is those recommendations. So for today, we are going to hear from from our consultant, Agnew Beck Consulting. So we have Thea Agnew Benben here to give an overview of the process. Agnew Beck and a few others have been our consultants working on helping us get out in the community, get public feedback, and then help produce and really produce this plan. So then we're going to come back after that to really having an assembly discussion around how we can move from the specifics written in the plan to the big picture. You know, what big changes do we want to make to the budgeting choices that we've made so far? Do we want to start putting into our structures more specific parameters on how we use the funds? You know, a conversation about how much we do as one-time funding or as short-term funding versus recurring kind of ongoing operational support. Those are the kind of conversations we want to have later today. But first, we will kick off again with kick off on the communications plan. And then before we do that, I will see if Member Bronga wanted to make some comments as well.
I just wanted to make a quick shout out to Claire and Jennifer, all the help, keeping us, the whip cracking, keeping us going on this, and Thea for your amazing leadership. So yeah, I didn't want to make sure that didn't get said. Thank you.
I have a question. Where are the appendices that are listed in the plan? My plan stops at page 19.
Yeah, Mr. Chair, we printed out the first section of the book. The whole thing it's about 70 pages. Yeah, so it was sent electronically, the appendices were. If you want them printed, we can do that. 55.
Yeah, I think it's pretty handy, but maybe it's not necessary to say it, but that's okay. Thank you. Go ahead.
Yeah, thanks. And then I will say there's copies of the plan and it's also linked online. So we're not going to do basically a line by line review of the plan, but we will get back to kind of an overview. And then we also want to, again, have that kind of big picture conversation and get some initial feedback on how we can make sure that this plan is useful for the assembly and for the community. So that's where we'll go later. But before we do that, I'm going to hand it off to Ira Slomsky-Pritch from the Ship Creek group, who has been also working with us on communications planning and part of this strategic plan process to, again, think about how we effectively communicate back to the community. So I will turn it over to Ira.
Thank you. Thea, do you mind? Are you going to do the slides? Great. I will try to move through this quickly to preserve a lot of time to talk about the substance of the plan, but we did want to start just talking about the work that has been done in the past on communications and how we're thinking about an ongoing communications effort around the alcohol tax. And I just want to say from the outset, I had nothing to do with the communications work that happened in 2022 and 2023. It was all Agnew Beck, and I don't want to take any credit for it, but I will cover that and then talk about what will go forward. So you all have been putting a lot of work into this already. The grantees, the nonprofits, the health department, the municipality. And so a big part of this is making sure all of that work is appreciated and the results that have been achieved are shared with the public. Our basic goal, if we boil this down to one thing that we're trying to achieve and measure here, is that the Anchorage public understands how alcohol tax dollars are spent. There's a lot that comes from that, a level of buy-in, a level of ability to give feedback. But at the end of the day, when we're thinking and when you all are giving feedback on what a communications plan should look like, I think it just comes back to this. Does the public know how alcohol tax dollars are being spent? More specifically, why? Why do we care about that? Folks who are buying alcohol are now paying for this, and it provides some level of accountability to the people who are putting in these dollars. Just like you go to a store and you get a receipt, there is some level of trust and accountability. We also think there's accountability in the other direction to you all as decision makers and policy makers, to folks administering grants at the department level. When people know how the dollars are being spent, that creates opportunity for feedback. Yes, this is what we want. Yes, this is being effective. And to that last point, when things are going well in particular, we want folks to know that so that you can keep building on those policy successes. So where do we start? There's a lot of text on the screen. I will just pull out the highlights. We did one of the Alaska Survey research tracking polls in January just to see where we're starting on this. Big takeaway here is that around 70% of the public said they were not sure or had no idea where alcohol tax dollars are going. Additionally, 60% of the respondents said that they thought the money just went to the general fund rather than dedicated specific purposes. So that's an interesting baseline. It's not super surprising. This is a new revenue measure. We're just starting to communicate about it, but it shows that there's a lot of work to do to help the public understand where the money is going. We did see that once the public learned, even at a high level, where some of the funds are going, that increased support by over 10%. Okay, so what has happened so far? Agnew Beck started this process back in 2022. They got input from a variety of groups, including the alcohol industry, who are important stakeholders in this tax, developed talking points, created presentations, and then also created a portal, a Reimagine Anchorage website with a lot of this information to become accessible in one place. I'm going to move quickly through this because there's some more visual examples of this stuff in the coming slides. They launched a specific Cheers to You Anchorage campaign in 2023 that took a lot of that content and the groundwork that they did in 2022 and made some pretty cool content. There were posters that went out to restaurants. There were coasters with QR codes. There was video testimonials that lived on the website. There's impact stories, highlighting all of this because all of that work, it's still out there, it's organized, and took a lot of work. And I think going forward, when we transition into that piece, we really want to build off of the significant work that happened to work with the nonprofits and the folks who shared their individual stories, who've collected them in video format. We have it all. And that's just a really incredible foundation to be working from going forward. Here's some examples, posters that went up at alcohol serving establishments, restaurants, and bars, coasters with QR codes to more detailed information. Here's a little bit of a closer look. Each of these coasters featured different, this is an example, this wasn't what all of them featured, pick different investments that were made by the alcohol tax and featured different ones. So 2 more slides here. One is, this slide is about what we're gonna do this year. And then the final slide, which is relevant and I think maybe a helpful transition to the general planning conversation, is what can be done on an annual basis that can become sort of routine to help achieve the goal of increasing public awareness. As far as this year goes, we're gonna take all of that content that's been collected and try to more proactively get it out to the general public in addition to the direct stakeholders. We've updated the website to just really lean into the Cheers to You Anchorage tagline, which we think is specific to the alcohol tax, but also positive and uplifting, and it gives a sense of thank you. And direct people to the website, whether that's through additional outreach with the alcohol industry, digital ads, social media, videos. Yeah, next slide, please.
There's a question from Claire.
I was just going to let members know that we are currently printing up a full packet that has the appendix for you because I do think it is important for you to see. And then while I was looking in it, I did notice that the results of the survey are not in it, just the table of contents. But I did want to maybe have you at the end of your presentation. I believe that the majority of people, even though they weren't quite aware of what the alcohol tax does, were still supportive of it. So maybe
Yes.
you could get into that a little bit too in your presentation.
Yeah.
Sorry to interrupt.
And there are the highlights from the survey or on page 19?
Yeah, and we're happy to provide that too, if it's not part of what's being printed.
Also, Mandy, are you there? I'm hearing the YouTube is not streaming. We'll proceed for now. I'll try to figure it out.
Part of the request for a strategic plan about the alcohol tax included an accountability and transparency plan. And what we're trying to do is think of what is a cost-effective way that protects the alcohol tax dollars for their primary purpose of addressing all of the issues that the alcohol tax is intended to address, and creates a time-bound, somewhat easy to execute way to, on an annual basis, provide some accountability and transparency to the public. And we've broken it down into these buckets, and there's a more detailed plan in the plan, but here's the summary. It starts whenever it's appropriate for the municipality to start reporting the previous year's activities, gathering all of those, where the funds are spent, putting it in one place, highlighting some of the stories, using a website as a centralized portal for all of that stuff. And then on an annual basis, having some routine around doing a press launch about here's where all the alcohol tax dollars went over the previous years, here's what was successful, here are the impacts we're seeing, finding a cost-effective way to direct people to the place where that information is being held. And then to the extent it's possible, we think it would be helpful to continue to track public awareness on an annual basis using a similar type of survey or question where you can see, is what we're doing making a difference? Is there a growth in the people who are saying, I'm aware of where the public, or of how the alcohol tax dollars are being spent? Happy to answer any questions about this. Again, more details in the plan itself. But the goals of what we were trying to do here were give the public the information they want and need to understand where the tax dollars are going, but do it in a cost-effective and a time-effective way.
I don't see any questions.
I think that's all.
Yeah, thank you. And then just a reminder that the communications work is ongoing, and thanks, Ira, for the clarification. I'll also make a brief disclosure that I forgot to do earlier, and that is one that I am a former employee of Agnew Beck. I actually am coming up on a year since I left, and we determined that it would be best to continue that disclosure until that 1 year mark. So I'm saying it now. Also, I did briefly, only in 2022, do a little bit of contract work on that while an employee, obviously before I joined this body, really before I started running. And so, I was part of that early on, but I'm happy to see that the work carried on. So next we will move on to giving an overview of the plan itself. So I'm going to turn it over to Thea. Thank you.
Morning, everyone. I'm Thea Agnew-Bemba, and I'm one of the principals and co-owners of Agnew Beck. We had the privilege of working with the municipality to develop this plan. We responded to an RFP and were selected. And as Ira shared, we've been working on the communications work for the municipality prior to that, and are carrying on with that work. So I'm going to start right now just giving you an overview of the plan itself and the process that we went through to develop it. Then we're going to go back to Anna, I believe, yes, and Karen. And then we're going to come back to me to do a bit of a deeper dive into the contents of the plan. So just wanted to let you know that that's coming up and it's not the part I'm going to share right this second. So if you look, if you have the plan in front of you, if you want to skip ahead to page 14, that's where we give you a pretty mini summary of the process. And I hear that the appendices are coming. I'm going to refer to a couple of those as well. But just to give you an overview of the process that we went through, we kicked off in the fall of 2023 and pulled a steering committee together that included assembly members, some staff from both municipal departments and for the assembly, and then also community partners were included in that, and especially those that helped advocate for the creation of the tax to begin with. And we actually added a few more partners along the way. So our full steering committee was really kind of in place by about January. If you look at Appendix B, you can see a list of all the steering committee members that came together. We worked with that group as well as doing a pretty comprehensive review of other similar Alaska plans that are relevant to the areas that the alcohol tax is meant to address. So, Alaska has a domestic violence plan. We have plans related to child abuse and neglect prevention. We have plans related to housing and homelessness. So wanted to make sure we were consulting all of those plans that have gone through a process and are already supported by the public. That brought us to a point in February where we had a pretty okay kind of draft plan pulled together. We had our kind of big picture goals and some of the strategies, and that's when we really started to do the community engagement work. And if you go to a appendix D and E, you can see probably more than you're even interested in about the community engagement work that we did. I actually ended up putting in a ton of the notes from our focus groups in there. We had an online survey going the whole time, so we ended up surveying about 700 people at the strategy level. One caveat to that is that as we were doing our engagement, we were also adding strategies, but we didn't change the survey midstream. So not every strategy that's in the plan was also included in the survey. So that was just kind of a mechanical issue. But you'll see there, how people ranked some of those strategies that are in the plan. And then we also went through a series of community presentations at bigger events. You can see those detailed in there. And then we also did a series of more in-depth focus groups because we wanted to make sure we were hearing from behavioral health providers and people who are working on homelessness and people who are working on domestic violence, sexual assault. So we did those kind of deeper dives with those groups. We also made sure to talk with our tribal health organizations that are operating here in Anchorage, as well as Cook Inlet Tribal, Cook Inlet Housing. So wanted to make sure that we were hearing from Alaska Native serving organizations as well. So that whole process took us until the beginning of this month. As we were going through that process, we were continuing to refine the strategies and the goals, continuing to meet with our steering committee to go through that. So all of that has now culminated into the draft that you see before you. Also got some really good feedback, pretty detailed feedback from steering committee members, your staff, that I think all have helped make the plan better than it would have been otherwise, which is awesome. So what I'm hoping we can do together today, and maybe this is a too tall of an ask, but you can tell me, I would love to know, is this kind of mostly cool? Are we good pretty much here? Or are you going to be like, we hate it, we need to start over? Because if you hate it, then I really need to know that. If you mostly like it and there's things that you want to add or change or rearrange, that's easy to do, because the schedule that we're hoping to be on is that you basically can have a fairly complete version of this handed off to you by the end of this month, so that you can then go through the process that you're going to want to go through with your own public review process. Because ideally, we would love to have this ready for you to use starting in July, when the administration and you are starting to think about the budget for next year. So it would be wonderful to not lose the opportunity to use this fairly soon. So that's this kind of overview of the process. I just want to quickly orient you to kind of what the plan includes. First, I just want to start with the title. So the mandate for this project was to do a strategic plan for the alcohol tax. Well, guess what? The alcohol tax is a funding stream, but it's directed at some really very significant and complex issues that we see in our community that are very much interrelated. And we felt like it was actually better to say, this isn't so much about a funding stream as it is about how do we build safety and well-being in our community, because that's what we're doing when we try and address those four, I guess we could say 3.5 issues that the alcohol tax is dedicated towards. And then the reason we're using the word roadmap is one of our steering committee members pointed out that a plan often has much more kind of tactical, almost down to the work plan level. This is really not trying to be that level of plan, because we want, the whole way along, we've really wanted to be sensitive to the fact that you're all policymakers. We don't want to tie your hands. We want to give you a framework and give you some really clear direction from the community, but it's got to also be broad enough that you have latitude in how you want to use it, and that might even change year to year. Some years you might want to be more connected to it than others. So the steering committee felt that the term roadmap for safety and well-being is a good name for what we're producing for you. So just want to call your attention to that. Oh, one other thing on the cover is we went ahead and did kind of a 5-year time frame for this. Because again, you are going to want to use it year to year. I think you're going to want to identify priorities from it year to year. But you also should be committing to kind of revising it within, I think, around a 5-year time period, because things might be different at that point, and you might want to really refresh what you've got here. And I'm just going to go through this, and again, we're going to dig a little bit deeper in just a minute. So we start with an action plan, and I won't dig into this right now because I think that's where Anna and Karen are going to go next. But we wanted to kind of give you some really kind of top actions right there at the beginning. And of course, we also just describe what the code says the alcohol tax is dedicated towards. We've split the plan into kind of 3 big sections. The first is the why. Why are we doing this? Why do we collect alcohol tax money to begin with? So in that section, you see the vision that the group came up with. As Ira was saying, some of this work started back in 2021, even when the first year the alcohol tax was available. So we really built from that work. You're going to see the vision is not that different in this roadmap as it was back then. When you look at the mission, I just want to point out that part of what is so complex about this work is that the alcohol tax is dedicated to not just one tough issue, but 4 of them. So we've got our public safety concerns, we've got child abuse and neglect, sexual assault and domestic violence, behavioral health, and homelessness. And so that's how we kind of decided to describe them in this roadmap. And then it's not just that we want to do something with one of those, we want to both prevent them occurrence and address the current situations. So right there, it's pretty giant. So just want to put that out there. And then we also came up with a list of values. I think these are a good way for you to kind of check in terms of how you're funding. What are the projects doing that are benefit from these investments, and kind of how are they happening? So that's the why section. The next section is what we're calling the what section. These are really the goals and strategies that are the main content of the plan that help you direct investments towards specific purposes. And what the steering committee really feels strongly about is when we think about prevention and also how to address current issues for these 4 interrelated community concerns, we often know that we always are going to come back to basic needs. Do people have their basic needs met? And so the goal statements are actually pretty broad around basic needs, but the strategies within those goal statements are very specifically directed towards the areas that the alcohol tax is dedicated to. So in the strategy column, you'll see the description of the strategy. In the second column, those are measures. Those are suggested measures. So these are all things that are currently being collected that could help you measure whether we're turning the curve or not. And then in that third column, it's telling you which of the designated uses this strategy works towards. And as you can see, some of them work towards all 4. Great. Some of them are more closely directed to 1 or 2. So we have 5 main goals, as I mentioned, directed towards basic needs. So the first one is around housing. Strategies are more specific within that. Second one is around having a steady income to support a basic quality of life. Third one is around access to whole person health, healthcare and supports. The fourth one is around having access to quality childcare, education, and training. And then the fifth one is that people feel safe and connected in their community. So that's the what section. Next section is the how section. How do we do this? And as we were engaging with the community, not only did we hear a lot about what needs to be funded, we heard a lot about how it needs to come out. And as we dug into it, again, this is fairly complicated. There's not just one way that these investments show up in our community. Sometimes they go out through grants, and those investments are perhaps the most visible to community members because they're actually applying for those grants and managing those funds. Others are going through municipal departments. Still others might go out through a more direct appropriation. So there's a lot of ways we can deploy this funding. So what we've done in this section is really try to focus in on the things that make those investments effective, efficient, and transparent. So this first section is about the investments being effective. The second one is a fairly long list about how to be efficient. The third is a shorter list about being transparent. And that leads you right into the work that Ira was just describing around communications. The next part of the plan is really a context section. So if you find yourself reading that what section and being like, what? Why are they saying we should invest in this? There's information in this context section that might explain some of that for you around how do we invest in prevention? How do we prevent adverse childhood experiences? How do we address intergenerational trauma, build on community strengths? And kind of what's our theory of change for this process? After that, you see the communication plan. It's really a sample for you that includes timeline and tactics, some of those materials, and then our appendices. And in addition to what we've already addressed, I'll just show you what's in these appendices. The first one is a sample plan for an annual process of how you could go about allocating these investments. The second one lists all of our steering committee members. The third one is a list of references for the plan and also suggested metrics. The fourth one is pretty long. This is where we get into our community engagement and survey results. So there's a lot of kind of more detailed information there of what we heard. And then in E is really just the description for you of that Alaska Survey research poll that Ira referred to, just so you know what we did. If you want to see all these tables, we're happy to provide them. It's just a really long report. I didn't want to add it all in here. And then at the very end are just some questions that might help you as you're thinking about specific investments. And with that, I think I'm done. Back to you, Anna.
All right, probably there are a few questions and comments. George, go ahead.
Is this the time to ask questions about what? All right, excellent. Just a couple questions. I'll go backwards from the way I wrote them on my own paper here. Can you describe again, Thea, if you wouldn't mind, how the goals were established? For example, it says everyone in Anchorage has access to safe, affordable housing, and the other overarching goals. Can you describe what those represent and how they were developed?
Yeah, good, really important question. So as we started to work with the steering committee and think about the dedicated uses, those community issues that are intended to be addressed, and think specifically not just about how do we address those in the near term, but also what does it take to prevent those issues over the long term. When you start looking at plans, when you talk to providers, talk to people with lived experience, what you hear again and again is it comes back to meeting people's basic needs. So when someone is not housed, when they have no income, they aren't then able to access the healthcare and supports that they need. You know, if a family, we know from Alaska research that if a family has a mom of a young age who hasn't finished high school and is enrolled in Medicaid, that child has a 5 times higher chance of being involved in child protection in their lifetime. So if we're going to really be serious about prevention, we have to first really think about meeting people's basic needs. And that's a fairly complex set of things. You know, to have housing isn't just to have a unit, but then you also have to have, you know, finish some education, get some training so that you can also be employed. You know, well, to do that, you also need childcare. You know, so all these things really do fit together. And as the steering committee was trying to think about how do we frame this out in a way that makes sense, we really just kept coming back to, well, there's these basic things that we know we need to meet. And then within each of those, there's some really specific ways that we can work on those to address the issues that the alcohol tax is meant to address. And so that's where the strategies come in. And so the strategies are quite specific and came out of that community process, but they're organized under those 5 goals that are much broader.
All right, thank you for the answer. A couple other questions, but just to say, perhaps, as a suggestion, there may be a difference between everyone in Anchorage has access to safe, affordable, and et cetera, across them, and Anchorage has it. And the reason I say that is because I think you mentioned something earlier on. I think it was mentioned earlier on, accountability. And so the question of accountability to the targeted focuses of the buckets describes to me what the city condition should be. And the extension of that word to everyone may just be just a language barrier to a broader understanding of it, because you identified that the targeted understanding of what this goes to raises the approval points by 10%, right? And so those buckets are very specific. And I think that it, just considering another way to phrase that may be beneficial.
Can I just quickly respond to that?
Yeah.
The reason that it is phrased that way, and we don't have to stick with this, but we also want to acknowledge that, and this is written in the context section, that Anchorage, the way that those issues affect people in our community is not even across the board. So there are, groups of people within our community who are experiencing those issues much more frequently and are much at higher likelihood to experience them. And so when we say everyone, we're trying to say, yeah, I have access to safe and affordable housing for me, but we actually need to create a community where that's available to everyone, even people who are experiencing behavioral health issues or who have grown up without a lot of support. So that's why we phrase it that way. Yeah.
Well, you raised the next point that I just want to make sure I captured as well here. I don't see in the values section the language that was utilized in the action plan section on the third page that described the buckets, and then it also described, to your point, relevant to all issues addressing inequity in our community, right? And so I think that's what you're talking about. But fundamentally, then that means specificity to the marginalized community then, right? And so the specificity becomes another point of that conversation with respect to the language appropriation. And so I would also add that into that the value of, very specifically, the value of equity is not identified as a very clear indicator. And in disparity, what does that mean? Is it a subjective? Or are we going, right? Are we going to measure it based on the indicators that we know? And can we be extremely clear as early on as we can, especially in these values, so that it is absolutely baseline?
Can I respond to that?
Yes, ma'am.
Yeah. So the way we've really addressed that in the values, the first one is the second bullet. We listen and respond to all communities. So that's really a key piece here, is that really in order to make investments that will be effective and that will reach the overarching goals of the, not just this roadmap, but of the tax itself, we really do need to get into specific communities and hear from them. So it's like for public safety, for example, there are communities in Anchorage that are experiencing a lot more public safety issues than others. So we really need to be listening and responding to all of them, not just the ones that maybe show up most frequently. Understanding that meeting basic needs is the first step. Honestly, when you really do dig into the data on all the things that we're talking about, those disparities in basic needs drive the disparities that we see in the issues that we're concerned about. And so one of the ways that we can make sure to address disparities and inequity in our community is by helping make sure that across the board, people are able to meet basic needs. And I can give you a lot of examples of that. For example, many of the people that work in the fields that we considered essential workers during the pandemic, high overrepresentation of people of color, high overrepresentation of women. Many of those jobs are getting paid less than $20 an hour. try to live in Anchorage on even $20 an hour, right? So as soon as you get into that situation, you then have parents working more than 2 jobs. That then leads to their kids maybe not having as much support as they would like to give them in school, et cetera, et cetera, et cetera. So what the steering committee really believes, and I think this is something that we can all kind of get behind, is the more that we can make sure everyone in Anchorage has their basic needs met, the less we will see disparities and the less we will see these really extreme outcomes of that inequity that's kind of baked in. And so that's how we've addressed it here. And we've opted not to do it the way that you were describing. That, again, that could change. So, but I think what I read and across the country, we had a speaker at the equity committee who talked about this. I don't know if you were there for that, but that nationwide, people respond better to policies that really address issues kind of across the board, and that link to people's ability to be, and I think this is what we all want, to take care of our families, to keep our families safe, to have our basic needs met, and to kind of get on with it. So that's kind of the approach we've taken. We could change that, but I just want to explain that's kind of where we're at. And I don't know if that's making sense to you, just if that's addressing what you're
I was
asking.
able to add up
Yeah.
the pieces. Thank you.
Okay.
So I have Felix in the queue and myself. So go ahead, Felix.
Yeah, thank you, Mr. Chair. Can folks in the room please turn off their mics? Awesome, thank you. So yeah, a few things. One, I think going to the piece that Member Martinez was talking about in terms of some of the explicit language, I appreciate you, Thea, talking about some of the strategic framing and the various discussions that the Equity Committee has had surrounding how we talk about these things, to try to gain the broadest level of support from the community. And I see that very much reflected in how that was framed in the why section. In terms of the what section, it reminds me of the work that the 2020 work group did. And actually there's, I think, several folks who were probably part of the 2020 work group, just looking at the participants who are also part of this group. So it's not surprising to me that that section looks somewhat similar. And I forget the name of that 2020 group. In terms of the how, that is where I have a few questions. And this may be questions for you, Thea, or maybe questions for the assembly members who are part of the steering committee. I'll just start with my first couple of questions, and then I'll stop and maybe get back in the queue. So the first question is determine, sorry, where did I find that? Okay, yeah. So when this talks about using the goals and strategies of this roadmap to make alcohol tax investments and sort of using this to determine the investments, so sometimes we on the assembly get some very interesting and good ideas from other parties that may not, those ideas may not align at all with anything that's in the what section here, but they very much sort of, we feel like on the assembly feel like this is something that we should absolutely invest in. Does this plan provide that kind of flexibility for us to make those investments without someone trying to hammer us over the head? You have to stick with the plan. You have to stick with the plan.
So I'm going to jump in there, Felix. I had a question similar to that, but I have it in the context of the actual document and what it says, pointing to page 24 of it. So it's in the appendices. It's the sample annual allocation process. And in a normal universe, maybe this is acceptable, but the assembly does not get engaged in this allocation process until August, September. If you read every step in there, this is 100% administration and committee group, whatever process gets established until basically the end of the process, where we're effectively given a document that says this is our proposed budget, and then we're left to scrap and fight and figure out if that's what we want. And so I have exactly the same question. And if it isn't answered in an affirmative way, then what I would recommend is figuring out a way to build in a better engagement with the appropriating body. So I'll hand it back to you, Felix.
Yeah, thanks. And then I'll go ahead and ask my second question. And if you want to address both, that's great. Sorry, I'm going to go back to my notes. So second question is, has the steering committee come up with what a funding group might look like? Because I'm looking at in your how section, the second point under effective investments and your goal of by 20 or 27 getting 30 million annually. And, I can think of a few possible funds. We look at HUD funding and leveraging that with alcohol tax funding, but I'm having a tough time getting to 30 million total. So has the steering committee sort of come up with what that funders group might look like and how you would achieve that goal? Those are my two questions to start with. Thanks.
Hannah?
Yeah, thanks. I guess I'll answer it at a couple different levels. One is the discussion about the how. That's really, when we get through questions about the plan, that's really our next big question. And I guess I'll frame it and then we can come back. But really the question is, if we want to use this plan, so whether it's this exact version or we change it, right? Whatever we do, are similar, and we're kind of thinking about this similarly to the assembly priorities process, right? Where it's a policy document. It is not a binding document. It is not the only things we work on. It does not constrain us from doing other things. But it is a way to, I guess, for lack of a better word, discipline or focus ourselves in what is inherently can be sort of chaotic legislative process, right? It's a political process to decide where funding goes. Are we as a body interested in basically putting more of that constraint on ourselves, or at least more, as I said, discipline is maybe not the right word because I'm not saying discipline in a punishment sense, but I'm saying that we are going to collectively agree to either follow this process or follow this general prioritization or a rubric for making funding decisions. That's really the question that we want to put on the table. So and I'm not going to give one answer for it right now, but I think that's really the thing to think about. And that is what a lot of is baked into this plan. I guess the other thing I'll say is this plan, as it's written right now, is the result of the steering committee's work and community input. And granted, everybody in the community did not go in and say, here's exactly what your grant making process should look like. Some of it was feedback on the way things have gone so far. But I think also in terms of those decision-making processes, that's one of the things we wanted to bring back to this group. So the sample that Mr. Constant referenced in the back is really a sample, and it is an idea of if you were going to do the process significantly differently and you were going to build in more of a outside advisory group or a committee or some other entity where that is discussed prior to the appropriation process, then that is a way to do it. So we're not, and that's the reason it says sample, right? It's not saying that this is what we should do, but that is what it is. And then in terms of leveraging funds, I don't know that we had a specific conversation about that particular number. I think the idea was just a one-to-one match if possible, right? And it maybe not for all things, but is there a way to leverage that, whether it's private funding, state matching funding, whatever it is. So I think that particular thing can change. But I guess I'll say for the big picture, that's really what we're coming back to you guys to talk about and to say as a body, what are we wanting to do? And then I guess the other thing I'll note just on the kind of involvement of third parties or outside parties in that funding decision, that's again something significantly different than what we've done to date, other than folks coming, and Mr. Rivera mentioned the Theory of Change group. That was the group who engaged in 2020 and 2021, especially initially, and then ongoing, really to advocate for that focus on prevention and upstream investments, as well as community grants, as opposed to keeping all of that money within the municipality and funding operations that way. So anyway, all that to say, that's really a big conversation. And so, at least for my part, as one of the sponsors, I would love feedback on that, knowing that ultimately it's what we want to decide to do. But what we are bringing forward is what, so far the community has said and the steering committee has recommended. And then I'll just leave the rest of it for the next discussion.
You want to follow up, Felix?
Thanks. It sounds like we're going to get into the how discussion soon, so I will wait to get back into the queue until then. Thanks.
Yeah, so I have myself in the queue, and to that end, what this does is it repeats the budget process, which we have come to a conclusion is inherently flawed. Since Felix and I have been on the body, we have been attempting to drive the administration to work with us on the budget earlier, insofar as we even started having a May-June conversation in the past, which we stopped now because we have an administration unwilling to work with us, where we set out our priorities for the budget year and let them know. What the administration has done since this administration has been in office is said, we are not talking to you until we deliver to you the 120-day letter. That is all ours. And then once we do that, then you can do whatever you want with it or not. We'll implement our budget however we want, and we have to fight over it. So the 120-day letter is September. And so if all of the decision-making processes are run through and sorted and decided, and then finally we just get a letter that says, this is the plan, we are boxed out of the process. And so then what ends up happening is you have a budget proposal and a substitute budget proposal that are substantially different and not worked collaboratively. And so to that end, what I believe needs to happen is, like we've talked about for our regular budgeting process, any process that sets priorities needs to begin and end with the assembly, not just be an administrative process done in the dark and secret or meetings that are published, but the assembly is only obtusely invited to, and then concluded by handing us a letter that says, if you don't do this, then you're bad people. And so, yeah, please.
I just want to be clear that the goal of the process that's described here is absolutely to be collaborative. So if it's not speaking that way to you, we need to make some edits. But the goal, there's a few goals here. One, I've worked on these issues for a long time. I mean, my very first job as a contractor was around child abuse and neglect prevention. That was like 28 years ago or something. So to do a good job with these requires not just money, but it requires deploying that money in a really smart way. And money by itself, it doesn't do anything. So when we spend money in a kind of, and this is true for everything, right? If we just kind of push it out there, it's not going to make a dent on these really complicated issues that we have. And so this how section is trying to position the municipality, which absolutely includes the assembly, the administration. It also includes community partners, businesses, lots of folks that have a stake in seeing these things be improved in our community. And so it starts by having there be some type of a leader somewhere that really owns this plan. Because unless there's one person who's got some authority and some relationships, it's not going to work. Right? It is not something that can be owned by everybody. There's got to be somebody who can pull it forward. The other thing is we think there really should be a committee, a board. I don't know who you want it to be. Could be one of the existing committees that the assembly has. It could be a board. It could be something else. But that it works with that leader that tries to really have that collaborative process be ongoing over the whole year. We also think that just agreeing to an annual process, whatever it is really important for that accountability and transparency with the community. Because right now, a lot of the community feedback that we got, nobody knows. They don't know how to apply for it. They don't know where to look for funding announcements. They don't know how to manage the money. They don't know when it's coming. They don't know anything, right? So until there's some kind of predictable process that you can publicize to people, I don't know how you're going to then be accountable. This plan, like we said at the beginning, can be used in lots of different ways. Like it's trying to not constrain you unduly, but it's also trying to give you some really good input from the community about what they think will make a difference. And it's not obvious, right? When you try to tackle homelessness, it's not obvious how to solve it. And this is trying to give you, hey, here's what we think will help. Okay, so it's good input. You guys can do whatever you want, really. But I think if you're going to go to the trouble of having a plan, that's what it's for. So I think the goal here is that you have some method for coordination, some method for consultation. You're learning from the previous year's investments, and you're using that to guide your priority setting in the current year. And you have some way to position this document and the result of this process to inform all of that. That's what it's trying to do.
And I think that the Assembly has a history of acting in that manner and has faced challenges in achieving a parable process. And so for my part, this allocation process, it just needs to be thought through with a slightly different lens that's very clear on points of contact across both sides of the government. In the times when things aren't so great, in the times when things are great, it'll be easier. But that way it's clear, because the first time the word assembly comes into this, it's at the end. And that's the normal way. That's how it's always been. And we're the ones sitting here doing annual plans. We're the ones sitting here updating our annual plans and demonstrating to the public we believe in this method. We just need to be included. And so, go ahead. Yeah.
I totally hear you. I think at the same point, to do a good job administering funding, that's a full-time job. So
Understood.
like that isn't something that
No,
I feel
there's-
like you
I agree.
will-
And
yeah.
there's a job here, and I
Yeah.
don't disagree the idea of designating an executive leader to manage a corpus of this size. It's reasonable. And it's just the process that has to be thought through.
Sure.
Because we've learned a lot about process in the last few years. Okay, I had a couple of other thoughts, comments on page 14. This is just a little one, it's just a detail, but your header on your figure 1, it's confusing. Anchorage alcohol tax revenue expenditures. So I would just kill the word revenue there. And then I think it says what you mean. Right? You're not demonstrating revenues there, you're demonstrating expenditures. Right, and so, because it's just slightly confusing, that language. And then there was a third point that I had. So the question was asked to me, how was the steering committee selected? Who chose, who got to sit around the table?
Yeah.
It was really, I think, municipal staff and their sponsors decided kind of what types of people. And then we pulled in the folks who had been active, to get the tax passed in the first place. And then we also opened it up to people who wanted to participate. So that's, like I mentioned, we kind of started with a group in November and we didn't have the full group until January. But we were trying to get representatives from people who had lived experience of the issues, who were working on the issues, who were assembly members, municipal staff, those experienced with administering the funding. So just trying to kind of see things from all those points of view.
So I know the work is done, which is fine, but it seems like there's limited insider knowledge about the behavioral health sphere of the world, what's going on out there in this list of steering committee members. There's representatives from the Children's Trust with youth issues and children, equity issues, certain narrow bandwidths of other communities. Recover Alaska definitely has some perspective on alcohol and issues related to that, but behavioral health doesn't seem to be here. Homelessness is with the individuals who are part of the youth board. So it certainly raises some questions about the who, but maybe really what happens with this is we have this initial document, we get closer to the next step, and then we have a broader conversation with folks that are more representative of the sub areas that are all listed out in such detail.
Well, part of how we organized our Agnew Beck team is I've been more engaged on the content, and I work with behavioral health stuff pretty deeply. So I was bringing a lot of that. I've also worked a lot on homelessness, and we did have a couple different meetings actually with the coalition, and it's been really good timing that both of you guys worked on your housing action plan, and then they were leading that process to revise the anchored home plan, which they gave us a sneak peek for. And then we also had specific engagement with the behavioral health crisis providers group, which Agnew Beck facilitates. And then we also had a specific follow-up focus group with them. So I feel like we did actually cover those pieces, even though you don't see individuals. Because our Agnew Beck team also had Tanya Iden, who was leading the public engagement, and then Josh Hemseth, and then also Lisa Fusek, who does all the communication stuff. So that's how we kind of covered those bases.
Thank you, Anna.
Yeah, and I'll add too, I think, well, I guess there's a lot of information about the kind of public outreach. And then two other things I heard. One is that part of this work was really reviewing plans that have already been done. Because I know, as you said, there's many of them on all the different topics. And so I suspect that a lot of these strategies are probably directly from a lot of those other plans. So there's not a full footnote or cross-reference. And similar to the housing action plan, right? That's basically 12 years of things put together into one. And so I think that's part of it, is really trying to lean on and leverage work that's already been done. And then the other piece is what I don't see in here, and I don't think is our intent, is to put in this plan, for example, give this amount of money to this organization, or to get really super deep into the specific fund this program, don't fund this program, because the goal, and I know some of these strategies are rather specific, but it's not saying exactly who would get the money or how much that would be. The goal is really to say, these are the types of things to be looking for that would be effective investments that are either proven best practices or address, as we talked about, kind of historic or ongoing disparities, things like that. So it's not intended to kind of direct funding to a specific place, but to say, here's what we should be funding if we're going to fund anything.
Zach.
Yeah, thank you. Just to kind of follow up on, I think Chris's question about the steering committee members. I mean, if I look at the folks on the steering committee, and there's a lot of very smart, thoughtful people here, so no disrespect to any of them. But it does seem to kind of have a pretty common theme, where it's a lot of people who have a lot of engagement with the homeless population and behavioral health and things of that nature. And then when I go to page 14 and I look at expenditures to date, looks like the bulk of them go into that bucket that is behavioral health and homelessness. And, it could be argued potentially that public safety, criminal justice, and then preventing child abuse, sexual assault, and domestic violence have been maybe a little under-resourced. And again, I can imagine how people who maybe their comfort zone is in thinking and looking at how to allocate funding towards addressing homelessness, which is, to say, a very important need. Maybe it makes sense to them that's sort of the more comfortable place to direct that funding. So with that, I guess, is there any consideration to expanding or changing the makeup of the steering committee to maybe bring in some people from these other realms that have been perhaps a little less engaged?
So we also did focus groups with the Violence Prevention Council. We did one specific with the crisis providers, which includes APD, AFD. The steering committee, I think, has kind of done its work at the, depending on how you all respond to this draft, I think we're kind of done. But that's exactly the type of body that could be convened on an ongoing basis to help inform you all as you do the work with this plan. And that's really what that's referring to in those action steps. The other thing I just want to caution you about is this graph that's on page 14 is really pulling from your budget document. And to be honest, there are some things in there that I think are not classified correctly. For example, the Providence Crisis Stabilization Center that you put $1 million into is under homelessness. That is a behavioral health investment, 100%. And honestly, we wrestled a lot at the beginning with this whole idea of, and this is a term I think we should get away from, buckets. As you'll see in the what section, the strategies that are identified generally speak to more than one of those designated uses because they're entwined like this. So I mean, even when you think about it, it's like, how can you think about public safety and not think that domestic violence is a huge public safety issue, but we're thinking of them as separate. That to me doesn't make a lot of sense. So I think I would encourage you to really think about how these issues affect each other and thinking about how do we deploy these investments that they really address more than one, because honestly, they do.
So I just want quick clarification, Zach. I think that this list doesn't have a broad array of behavioral health or other providers. It has two youth that are related to homelessness for homelessness issues there. But what was asserted was that the Agnew Beck staff are the ones who have the necessary kind of knowledge base on behavioral health and homelessness issues between them. So I think the question stands, like, representation of the various areas might be better served with some process, which was asserted could be a future next step. Anna.
Yeah. And I just wanted to clarify in terms of, because actually I don't think it's accurate that a lot of these folks listed on the steering committee, I'm looking at page 27, have direct work in homelessness. So the two listed, the Youth Action Board, are people with lived experience. So they are working on housing and homelessness. They're not providers. They're actually young adults. The 3 health department staff are directly working in homelessness, but also health department is the agency, and their specific division are the ones who are administering all these grants, which includes prevention grants. So even though their titles, some of the titles say homelessness, we're not here on the paper. That's where all of those prevention grant, like every grant has gone through the health department if it was allocated to the health or appropriate to the health department. And then a lot of these other folks are, at least some of them I would categorize more as community groups. So Pacific Community of Alaska, Alaska Black Caucus. And so I just want to be clear. And then the budget document, I think, was stated, that is really assembly appropriations over the last 3 years. And a lot of them were, for example, some money was appropriated to prevention grants. Not all of it was spent. It ended up in fund balance, and it got reappropriated to shelter dollars. So that was not a choice of the steering committee. And I would not even characterize it as a community-led choice, other than the fact that we have that community need, and there has been a lot of, advocacy to say we need to do something. But I wouldn't characterize that as the choices of the steering committee, which didn't exist at that time. And then lastly, I wonder if we could also, if that's the actual document, if we could go to page 18, or it's page 18 in the document itself. I don't know what page. Yeah, this one. So I want to point folks to that, because this is actually way back from 2020 as well, and has been reformatted. This really is what the theory of change put forward, and I think it's important to understand. So the idea, and it goes back to the way Thea characterized it, as focusing on basic needs and focusing on making sure folks have healthy relationships, have affordable housing, have education, all of those kind of positively framed things that we all want and need will help us address, and then it starts moving down the line, these issues where basically lack of those things, or the violence associated with interpersonal relationships, all those things, like that's kind of the whole logic of focusing on prevention. So I just want to point folks to that and point the community to that as a big kind of general thought around where the community has advocated we put money.
First Claire, and then Karen.
On the topic of the steering committee, we purposely kept it small because we had long meetings, 2 hours at a time, where we got into the nitty gritty. And we asked the steering committee to help us more with the process. Then they didn't really make any recommendations. They were there to help with the process and to help us figure out who we should talk to. And so I would, if you're concerned about diversity or if the right people were involved, I would encourage you to really look at that focus group list that starts on page 38. And that's where we really tried to get the broad expertise and diversity of the community. And if you feel like there's groups that aren't represented there, then that's where you could get feedback, and we could maybe take this draft out to more of those groups. I just wouldn't focus on the steering committee so much, because they were there to guide the process more than to give technical input.
Karen.
I was going to kind of say the same thing, that the focus group was really helpful in figuring out where we should go and introduce and have our sticky dots placed. And what the things that struck me when we met, we just kept hearing, we need this transparent process, more upstream investments, easy application, and make it no fluffy language, easy to read, accessible to everyone. And so that's the kind of communications we were getting from the steering group. They were recognizing the unbalanced scale in how we've been spending the money, and really looking that we are going to make changes in that, so that we are equitably, and, we're going to help lead that process, but we wanted to make sure we're equitably spending to the different goal areas. So
Others? Okay, anyone else? Are we done with the presentation?
I think we're moving on to the next.
Okay, the discussion, go ahead.
Yeah, thanks, everybody. Really good feedback on the plan. I think continuing the points that Mr. Rivera brought up and kind of where we wanted to go next in the discussion is really looking at the how. Instead of, so certainly specific feedback on the plan is welcomed, but instead of walking through kind of every specific recommendation in the how, I actually wanted to really pull it back and just have a discussion with the members. So we've had this alcohol tax in place for 3 years. There have been actually a fair amount of stability in terms of where the funding has gone year over year. For example, every year we funded about $2 million of pre-K classrooms at ASD. That's one of the items. There's the prevention grants that some of which have gone out that didn't get fully realized, I think, the way people wanted. And then really, we've also seen year over year, a lot of discussion about not being able to do multi-year grants, for example. So I think recently the health department has made the decision to make the multi-year grants that go past one fiscal year. But anyway, all of that to say, we really want to pull back and just have some discussion about, knowing that we've done this a certain way to date, how could we think about this differently, or is there appetite to think about it differently? And some of the questions that I want to bring up are, for example, with the funding. So we have about $15 million per year. And again, some of that is going into municipal staff positions, right? There's different uses for the funds. But as we think over time, one example is that we appropriated the mobile crisis team funding out of that for this year. So that originally was funded by alcohol tax for the first 3 years, was able to get up and running and really get moving. And now we found a different funding source for it. So it's moved into essentially general government. So that's one model of starting something and then being able to find other funding for it to keep it going year over year. So just the questions I want to put on the table, how much of this fund do we want to think about as one-time grants versus recurring year-over-year grants? Or I should say, not just grants, it could be internal funding to the municipality, but it could also be external grants. So the ASD grants, for example, are one, recurring year-over-year. It would be a policy choice to stop doing that versus one-time funding that is maybe starting up, or capital funding as we did for Providence, the stabilization center, those kinds of things. So one-time versus recurring. How much we want to split the funding between these different categories, right? So the list that we have in the charter and now in our code is really the menu. It doesn't say we have to put or we don't have to put equal funding to all of them. We could, in theory, choose to only fund one of those, some things within one category. That's maybe not the most strategic way to do it, but that's one thing to think about, is how we split the funding among those categories. The other one is really thinking, how much do we want to continue supporting operations, through grants, for example, the ASD grant. Or do we want to hold funding for basically big one-time projects, or, and that could be a few years. It could be funding something over 5 years and saying, we're going to put a bunch of investment in this one thing to make it happen. That's an idea. Another one is to balance between upstream prevention and again, continuing to fund things like emergency shelter, things that we need right now, but things that are basically managing an issue and not, getting ahead of it. So that's another way to think about it. And then also thinking about how we want to spend money in the community to different size organizations, different types of organizations, right? Because it is, a public investment in community work. And so do we want to make room for having small organizations get funding, for example, so they're not just competing with a large organization that has a much more sophisticated grant-making process? So that's a lot of questions to put on the table, but I would be curious, just, maybe if we had to start over, or if we're thinking 10 years from now, what would you see as success in the alcohol tax, or maybe what's something that we haven't been focused on doing now, but you would want to see us do in the future? Go ahead, Mark.
Go ahead.
I just want to add one thing, which I think gets at a question that Felix asked a little bit ago that we didn't really respond to. But I think another really good thing for you to think about is where can we leverage this money? Because this is actually, I think there's differing opinions here. I think it's actually a really healthy amount of money. Like to have $15 million a year reliably is awesome. And we should be very proud of that. And because it's designated to these uses, there's other money that can really help maximize your impact. So you've got a marijuana tax that's going to be dedicated to childcare and early education. That's a massive priority that came out of this plan. So how could you really kind of leverage there? There's a whole private funders group interested in funding around homelessness. How can we really leverage with them? You know, there's state money, there's federal money we could be bringing in. You know, we heard through this process that state corrections really wants to scale up their reentry programs. So maybe a little bit comes from here and a lot comes from there and some comes from the feds. So I think that's another thing to think about is like, where can you really strategically invest that it can really amp up the impact?
Karen.
I was also thinking of the model like challenge grants that, you know, if you get a group that would be willing to put their sweat equity into half of it and match, it I think could make this funding go even further. And at the chamber, we had someone who brought up this nice idea that if we, instead of just having people coming and piecemeal, I want this for this, that if we actually called on, this is our priority for this year, and we are calling on grant people to come in with a great idea of how we're going to solve this problem, and we kind of focus the people that are coming for money based on, so that's another possible way we could spend this.
Yeah, and we have a history of putting out requests like that and seeing what proposals come in and funding them. It's just, it's a lot of work and we have to sort through and pick, but that's great work. So, okay, others on this? Okay, next.
Well, I think the goal is to have some more conversation about that. So if, I would just be curious what other folks' thoughts are, especially those of you who have been around longer than I have.
I think where I sit, I need to spend time with this document that just landed a couple days ago and really contemplate what it says. And we could talk whatever we want about, yes, we should prioritize it this way or that way, but none of it's going to mean anything until we've had a meaningful opportunity to review it. And so I think I would reiterate what Felix kind of intimated, that there needs to be some flexibility even in the annualized basis, so that priorities that crop up can be addressed. So it's not all locked in by proposal early, but having priorities to achieve outcomes is a very important part of it as well. And so somewhere between the two poles of being prescriptive and being completely without a plan is where we should land. But it's hard to say meaningfully until I've really had a chance to consume this. Others? Karen?
I just wondered, with those of you glancing at this for the first time, does it look like a usable framework? If there's any input on that, I know that Thea would probably be interested. We kind of, Anna and Daniel and I sat down with the staff and talked about it, and so just other feedback from you guys would be nice on that.
Mark?
It is a very good product to start with, and I like Chris's Chair Constant's advice. There's a lot to digest in this. I've got a lot of notes here and a lot of questions, but I want to do them in a different framework. There's a lot of money out there that's not just the tax money that we need to have access to, and there's people that want to support this organization that we need to have access to before we can go expending the money in the right direction. I'm a firm believer that you have almost 8 different entities out here that's going to be focal points at which we need to focus on this tax money. And I think that if we can eliminate one in 2 or 3 years and then focus on the other ones and process of elimination, they're never going to go away, but we can eliminate the threat, so to speak, of 1 or 2 and move forward on the other ones. It's a start. It's a good start. And I would like to see where the rest of the money is coming from and the support before we make a decision where we're going to spend our money in long term. And to add to that, the basis at which we got our community involvement, it's past data. And going forward, we're looking at a 5-year plan. So I think that future data would be really good to grab because the cosmetics of our environment, the cosmetics of our community, everything's going to change between 21 and 24. And now we're going from 24 to 29. So that's going to also drive where the money's being spent. So I need time to digest this.
Yeah. Felix, you're in the queue.
Yeah, thanks, Mr. Chair. Can folks in the room please turn off their mics? Thanks. All right, so a few things for me just based off of the questions that Member Brawley asked. So for me, the question of one time versus recurring, and really I think all of the questions that you asked, I think go into the only way for me to really respond to those questions that you asked, one time versus recurring, splitting up in different categories, big versus small organizations, really all depends on what goals that we really have for the alcohol tax. And, one of the things that I'm having trouble grasping is there are so many different, in the what section, so many different goals and possible activities under the what section. $15 million sounds like a lot, but we can barely scratch the surface on even one of these, 5 goals with $15 million, right? So, for me, it would be really helpful, and maybe this is just something that we need to do as a body, is just sit down and and lock ourselves in a room and spend, a day just trying to hash out what does the next 1, 2, 3 years, the possibilities of our alcohol tax look like. Because we might have a specific goal in year 1 that naturally would say, yeah, we need big organizations to do this if we really want to make a huge impact on whatever our goal is for number 1. And in order to get it done, it needs to be a 3-year program. And then that sort of tells us for 3 years, this is where our alcohol tax is going to go to, right? I mean, if that's the goal that we have. So for me, I really need to get a good grasp on the goals. And I think I really appreciate the last page, the last appendices, the rubric, because I think it would be very interesting for us to really, as a body, go through these and ask ourselves these questions and really be introspective of, well, what are our goals for next year's alcohol tax? What were the goals and metrics of last year's alcohol tax? Did we meet our goals? Ask ourselves all of these kinds of questions as we look at how we want to achieve next year's goals and what they may be. So it's hard for me to really give too many sort of specifics right now until we as a body set that. I hope that makes sense. Thank you.
So all the questions that Anna just brought in, and Felix, what you're just sharing back, and Member Littlefield, what you shared, those were all like real, constant questions during this process. So it's not that hard to bring to you kind of a scope of actions that the community supports, but it is hard to come up with a way of advising you or giving you something that helps you determine how to do that because of all the things that you're raising right now. There's like a billion ways to do it, right? So that's why we included on page 24 that sample process, because, and I just want to spend a second just like walking through it, because that is, and I hear what you're saying, Chair Constant, that this isn't the right one yet. But I think it does start to get at what it could look like, because it's not that you need to lock yourselves in a room once. You need to be doing this around the calendar year, because these issues are broad, they're evolving. It would be wonderful if we could put one of them to bed, like you were saying, and then be able to focus on the others. That would be fantastic. And I think you could decide to do that. Like Anna said, you could say, hey, for the next 4 years, we're just going to focus on goal 2 or something like that. So this plan is there to provide you a tool to do that. But in that sample process, kind of at the beginning of the year, you need to review what you've already spent your money on and then get some input around that. That could then lead you into deciding, how do you want to prioritize in this year or maybe over the next 3 years? So that could be done kind of in the early part of the year. In April, that's when we really think some kind of communication with the community for around a quarter would be really helpful. So you're reporting back to them. You're saying, here's what we did last year. Here's what worked great. Here's what didn't work great. This is how we're kind of incorporating that into coming forward. And that you would also put out some of the money in some investments that goes out through grants, because that does need to happen earlier in the year in order for those agreements to be in place and start the spending the following year. So there's some timing issues there. We also suggest that there could be a request for letters of interest. And that's, again, where you're sort of soliciting input. Like, what do you guys think we should do? And you can share this plan. Say, here's our plan. What do you think is the priority within this plan? And kind of have a way to bring that in. And then using that through that advisory body process with that leader, whoever it is, of course, with all of your involvement in kind of the middle of the year, so that you can then kind of feed that into your budgeting process. And so I think this roadmap is trying to give you a starting point for figuring out what would that annual process look like. Because again, without some intention about that process, nobody else knows how to fit in. And the goal is not to curtail you in any way, but I think by adopting some predictable structure, you can make it easier for all the pieces to work together, which is what needs to happen in order for this money to be invested wisely. Because when those pieces don't fit together, it's not going to have the impact. And that's not good for any of us.
Anyone on the phone? Go ahead, Anna.
Yeah, and I'll just add, that was kind of, I think this conversation has really taken us up to the point where, this plan is now available as a draft. We want feedback on it. And of course, there's just 3 of the 12 members involved necessarily so far. And so that's where we really wanted to bring it back to the body, knowing we wouldn't get, a full answer today, or that we would have the time or capacity to work all that out. But that's really, I guess, the ask back to the group. And I guess in terms of next steps, because I know we have limited time today, and people want to have time to digest it, which makes sense. That I think the question would be then, how do we want to proceed from here? So the timeline that we're on right now is, it gets, of course, depending on how we feel about this draft, right? But in theory, let's say by the end of the month, that was the timeline that we put forward. If we get this draft to a point that we say, yeah, we feel good about this, and then we have the option to put it out to the community as a public comment, similar to what we did with the strategic plan. So not just our bare minimum of where you introduce something on the agenda and there's a public hearing. We could do that. We can make significant changes to it. We can schedule that time as a group. I know we're moving into summer and we've already got a lot going on. But that is a conversation to have before the next budget cycle. And of course, we're still waiting to see what happens with the election and all those other things. So there's uncertainty around timeline period. But that's maybe the next step, is to decide what else we want to put in here, or do we want to try to design that process for ourselves? And so that's really the question I have out to the group.
Go ahead, Karen.
And one of the suggestions that I would have is when I look at, and this may not be easy to do, but when I look at goal 1, it looks digestible. And then when you look at, goal 2, the list is really long. So I'm almost thinking if we could narrow the number of options on each goal and keep these other ones, but prioritize like 4 for each section, keep the other ones kind of there. And as we solve problems, we bring these different areas in, but it just looks like so much that maybe we could cut that down to a more manageable chunk or slice there.
I'm just going to say the same thing I said before. I can't meaningfully answer those questions. Should we act tomorrow? No. Should we act at the end of the month? Probably not. Should we spend some time figuring out how to act after we've had a chance to consume this? Probably. What does that look like? It's probably better for me to answer after I've had some time to really think it through. And so I'm in a kind of a catch-22 here that, like, I would say, put it on the rules committee for next month. Let's talk about where we go, after we've had some time and people have had an opportunity. And then maybe we can meaningfully contemplate how to be deliberative. But at this time, there's no way to do that. We could shoot spitballs at a wall or, and just riff. But I think the whole point of this is don't just riff. And so I would suggest a little more patience. Go ahead.
I wasn't suggesting doing that today.
Yeah.
Like in the future, maybe we can cut that down a
I was
bit.
responding to Anna's framing of how do we act, do we?
And then one thing, I think I'm hearing that you feel like the assembly has to have a greater participation early on. In my head, I wouldn't feel bad about having a committee of people other than assembly working pretty hard at a framework to start with. And I mean, we have a lot of it on our plates. And I think people who are really passionate about working on these areas, it's maybe more appropriate that they're on a steering committee to figure out the plan moving forward, or, to review grant packages. I mean, it's going to be a big job.
Right. And much of that will fall onto the administration. It's the tactical and strategic questions we have to sort out ourselves. So, Mr. Salt. Randy.
Thanks, Chris. So I really appreciate the plan. It's better than playing whack-a-mole, and I think it'll definitely enable us to have more impact with these funds. I guess what I would like to see, and again, trying to digest all this, is I like the designated use circles that call out which parts can use. I could probably use a little more depth in there. Some of these, I'm just trying to stretch how they match up with the initial ballot language. The other thing I want to make sure is when we build this, we don't build in a huge administrative burden that then directs more money to administering this versus actually getting to the coal face and helping the people in our community. And I'm sure the sponsors are aware of that. Thank you.
Felix.
Yeah, thanks to you, Mr. Chair. So for me, I think it's important, I think echoing some of the things the chair has said, that we leave ourselves a little bit of time to digest and see if we want to make some changes to the framework as really a framework for how to achieve the plan. And I think that's essentially what Thea has been suggesting, is this isn't the plan. This is a way for you to get to a plan in the end, right? And I think, getting to the question that member Braga asked, yes, question mark, is this a framework that could work? Yes, it does sort of gut feel like it's a framework that could work, question mark, but I need to go through it in fine detail and just see if there's any changes I want to make. And I would say, and it sounds like this is something that since we're talking about sponsors, this is something that eventually folks want to bring to the assembly for approval. I would suggest that even before we look at approving this, that we test the framework actively before we adopt it. Because if we're going to adopt something like this, I really want to make sure that this is something that can work. And then to the idea of prioritizing or possibly cutting things from the framework, I'm not necessarily sure that's a good idea, but absolutely we should prioritize and cut things from the plans once we use the framework, right? But I think the way the framework was developed, I don't think anything's prioritized in there. And I think that that's intentional. It gives us the space to make those kinds of policy decisions. And lastly, in terms of some type of advisory group, for me, I really want to wait to see how the advisory group set up for the marijuana tax works before we even set up any other kinds of advisory groups. That's how I want us to take a wait and see kind of approach. Because, honestly, we as a body have been pretty used to setting up the alcohol tax over the last several years and how we do it now. Obviously, this framework is looking at upending that and doing something totally different, which I appreciate. But the way I see it, this is all stuff that we as a body can do. Doesn't mean we can't rely on the administration to do the heavy lifting or other third parties that are experts to advise us. But I do think that, at least for now, the way I envision this framework being used, it's primarily an assembly administration kind of thing. Thanks.
Claire?
I was going to mention that part of our reason for, rushing it a little bit is so that you would have it in time to make decisions, so that the assembly could be involved early in the process and make budget decisions this summer and have these discussions. But this plan is supposed to last. The alcohol tax is going to last forever. So this plan doesn't need to be rushed. So I was just thinking with what Felix was saying is I think there could be two concurrent tracks where we do go over, maybe have a work session on some of those questions on that back page to get you in the mind frame for this year's budget, while you work with Agnew Beck on longer term of getting this plan to where you want it for the 26 and beyond budget. So we might have two concurrent tracks.
That's fine. In the context of this year's budget process, much depends on what happens next week. And I would like the assembly to get back to what it did from the broader budget perspective, which is in June, July, have some conversations about our broader priorities, not just alcohol tax priorities, that we communicate to the administration as they begin building their budget. And historically, when we were doing this and we first implemented it, the administration at the time worked with us in the room. So when the priorities were being developed, they were shared priorities. So there was one budget that came out, so that there weren't two budgets at the end of the year vying for a majority of votes. And so procedurally, my hope is that we get back to that. We have a robust early conversation so that the assembly is heard, and then we don't have to do all of that double work. And so then this would be a subtextual conversation of that broader conversation if we don't get through this process this year to inform this year's budget on the process. Yes.
Just two things. One, I just want to say again that the goal of having that collaborative process is what's trying to be communicated here. And so that advisory committee, we were thinking could be one of the assembly committees. So it doesn't have to be a separate thing, kind of like the marijuana tax is set up. It could be just part of the process and be just a venue where you have that type of collaborative conversation. In our kind of outline for today, I was going to walk through the what section with you, and I would love the chance just to do that.
So,
Understand that you haven't read it yet, but just to kind of orient you a little bit to help you as you go do that deeper dive. So if there's a chance for that, I'd love to do it.
Anna?
Yeah, thanks. And thanks for reminding me, Thea, because that was on our plan as well. But I guess what I'll say in terms of proposed next steps, and then I can reiterate them later. So it sounds like, and not because we can map out the whole process, but I think what I've heard so far If we can give members till the end of this month, I just looked Friday, May 31st. That's the last day of the month to do that initial read in addition to the conversation we're having today. And again, we can change this. I'm just putting it on the table. Give till the end of the month to get review. Any comments you have, big picture questions, any feedback you want to give would go to staff, to Jennifer and Claire, so they can collect that. The next rules committee will be Thursday, June 13th. So if that's amenable, we could make time there to continue this kind of discussion about next steps. And then also, I think we could, by that point, staff can collect and compile that review. And then we can talk about how to proceed. And then I think it sounds like, I'm not sure how we get there quite yet, but it sounds like in order to finalize this plan, so let's say, we make changes, whatever needs to happen, maybe what's missing from this plan that folks want to do is, and we should do before we try to finalize it, is some kind of decision or framework as a group that is on the other side of this discussion that basically says, what do we want to prioritize in terms of the goals and these strategies? What, if any, shifts do we want to maybe start working toward in the budget, whether it's FY25 or beyond? In terms of, like we said, do we want to start moving toward making room in the budget for one big project or, things like that? Just getting toward that conversation. And then also, what big picture process recommendations do we want to make, to the point that Chris just made around working collaboratively with the administration, working earlier in the year to identify priorities, thinking about how we solicit ideas from the community, kind of all of those big process questions. And so I think we're not at the point that we can decide those things, but it sounds like there's maybe a timeline over the next 30 days to at least move forward in that conversation. So that's what I would recommend. And then I'll also just note all of these conversations around how we invest money, what that looks like, what intentionality do we put behind that. We are absolutely also going to have that conversation with the marijuana tax, and it looks different. But just to note that a lot of the conversation around that particular project is directly informed by and trying to do, I think, better than some of the lessons learned that we found in the alcohol tax. So just as a preview, we're going to have this conversation again. It's a different animal in a lot of ways, but I think the bottom line is, how do we again put additional intentionality or more strategic focus in what is inherently a political process, which is budgeting by a legislative body. And so that's really the big picture question. So we're going to have that conversation twice. And so that's what I would recommend in terms of next steps, unless the chair has other ideas.
Yeah, I think coming back to this at the rules committee and then digging in one step there is good. We can talk with staff about the 2-track conversation as the conversations emerge between whether we have an administration continuing or a new administration. So all things are subject to change within the next few hours. 100 and something hours.
Mm-hmm.
So, okay, others? No? Okay. So you want to lead us through that framework that you wanted to share?
Okay, I'm not going to go through every single strategy, but I just do want to point out a few things. So this really starts, as I mentioned at the beginning, with what we're considering really 4 uses for the alcohol tax revenue. And those investments, the first one's public safety, second one, child abuse and neglect, sexual assault, domestic violence, third one, which we're calling 3A, is behavioral health, fourth one, which we're calling 3B, is homelessness. So that's what it's designated for. Also, we've been careful to put the verbs, I know this sounds real pedantic, but prevent and address above the uses. So in some of the communication that we did, even at the beginning of this process, they were sort of all mixed in, and people were like, well, wait a minute, does that mean you're not preventing behavioral health? So we want to be clear that no, those are the 4 uses, and for all of them, we're concerned with both preventing them over the long term and addressing the current issues. So that's how it's set up for each of the goals. When you see a star, that's where we really heard a lot about that strategy. So either when you flip to the back, you can see those survey results I mentioned at the beginning. We had an online survey going from mid-February to May 1st, and we had about 700 people respond to it. So when we would do our public presentations, people could then use that QR code to do the survey and voice their support for the different strategies. And as I mentioned, we also included strategies that we heard through the focus groups. So not all the strategies that are in the plan were included in that survey because some of them were developed during our public engagement. So everything you see that's listed as a strategy either came from our very initial group discussions with the steering committee, but those were really supplemented by looking at other community plans that are already supported and passed in Alaska or Anchorage, and then mostly through what we heard from our community engagement. So I just want you to know that the strategies here, I think, are very community supported. And we didn't hear a lot of divergence. There's a lot of kind of common understanding, which was kind of a nice surprise to me. That when you ask people like, how do you do this? They all kind of had pretty common things that they brought up. So I just want to highlight a few of those for you so that you can kind of, just help you as you start doing your deep read of this. So under our first goal, which is related to access to safe and affordable housing, we heard a lot about this. So didn't matter which group we were talking to, housing was probably one of the first things they brought up. So in that first category, we're really concerned with, in that first strategy, we're concerned with low-income households who have young children, because we know from many different studies and plans that housing insecurity, when you are little, leads to many of the other things that the alcohol tax is trying to address. So that's a real big one. And when you look at that suggested measures column, that's trying to give you, again, a little bit more detail about how you might measure that. And all of those are measures that are being collected already. So we're not saying like, let's set up a whole new data collection thing. We're just saying, let's watch these measures for our community as we make these investments. Emergency shelter, also very important. People were very clear that means small scale shelters where special needs of different types of individuals can be met. The third one was really talking about transitional and supportive housing, because I think what we've experienced a lot of is when we try and move people too quickly into permanent housing, sometimes it doesn't work out. And so having that kind of middle space where people can get stable is really important. And that leads right to the next one under housing. And you'll see this one repeated in each of the goals because it came up so often, which is we really need navigation, case management. We need flexible funds to help do things like pay the $25 to get your driver's license, get the bus pass, help fix a car, all the things that help people get back on their feet and maintain employment and housing. So that's what's there. Goal 2 is having a steady income that supports a basic quality of life. And we heard this over and over again in terms of, well, if someone's homeless, they need to get a job. So that was a message we heard a lot from the public. When you dig into plans and research, again, what you'll find is having the ability to maintain the basics of life are super protective for young children. They're protective for women who otherwise might be vulnerable to domestic violence. So it's a huge issue. So what does it take to help get access to a steady income? First one is a living wage. So I mentioned that a little bit earlier. That came up again and again. And interestingly, it didn't come up only. So for example, when we met with the chamber, we got a lot of feedback after that from people that filled out the survey saying, hey, this is true for people who work in restaurants. So it's not just on the kind of social services end of thing. It's also on just our working public, which is a huge portion of our community. So how do we support making sure that people can take care of their families with a 40-hour work week instead of an 80-hour work week? Childcare came up over and over and over again. That guess what, guys? I can't go to work if there's no one to take care of my kids. So again, that's an opportunity with the marijuana tax. And then the third one you see starred there is, again, that navigation and flexible supports. It's really hard to maintain employment if you don't have transportation. It's hard to even get to your job training program. So the rest of the ones under here are kind of along the theme of helping people get to all the awesome vocational training that exists in our community. We talked to lots of different entities that deliver those programs. So a lot of it is just sort of helping connect people to the right opportunity, whether that's an apprenticeship whether that's going from being a certified nursing assistant to being an LPN and moving up the pay scale in that way. So that's what a lot of those other strategies refer to. Under goal 3, this is where everyone in Anchorage has access to whole person healthcare and supports. This one does have a lot of strategies, as Karen mentioned, and that's partly because this is really where a lot of the behavioral health and substance use part of the that designated use really comes in. So the first 2 are really around just increasing access to those services and treatment. We heard that again and again. For substance use, we also really need, and we know this, we've known this for years, a more immediate access to withdrawal management for people that's not in an inpatient environment necessarily. And that leads us right into the third one, which is increasing behavioral health crisis care. We heard again and again about how incredible the mobile crisis team is. That's a great investment that we've made. People on all sides talked about what a wonderful team that is and how they use them and how they really help. The next one really gets into a little bit deeper into that, which is how do we then connect people from a crisis into longer term services? So there's some work we can do there. People really want to see behavioral health and physical health care delivered together in different community settings. So schools, libraries, in mobile locations. That also came up last summer in the complex care task force. That was a big priority of that group. A lot of interest in people who have experience with corrections. So this one here is to increase the number of treatment beds when people are in a Department of Correction facility. But then you'll see later on, there was also a lot of support for reentry services. So how do we help people come back into the community? A lot of interest in more early intervention for families who are at risk of maltreatment. Oftentimes what you'll find with child protection here is that we try not to intervene unless it's a real safety concern. And so sometimes families will have 8 reports of harm that don't rise to the level of an intervention. So there's a lot of interest in how can we intervene with those families sooner and avoid them ever having to go through an experience with child protection. Some of the other things under this list really, again, get back to kind of case management and helping housers repair units when there's damage so that they can continue to house people who have behavioral health services and need those supports on an ongoing basis. Again, back to that case management, navigation, peer support. There's a real interest in food security. You know, we heard from one focus group that the best way to keep a senior housed is to provide food security for them. That's often the thing that kind of tips them over into homelessness. Prenatal screening, being trauma informed, helping attract a workforce, those were other things that came up. Goal 4 is really investing in quality childcare, education, and training. And this really, I think we heard across the whole age spectrum here. So there's obviously the support that we can give to young children, which again, the alcohol tax is making great investments there, expanding pre-K, expanding access there, but it's also around their parents. So how do we also provide support for people to pursue education, to get the training that they need, again, to help them move up the pay scale, get employment, and then of course, childcare helps people maintain employment. So the strategies under there are really about that. And then we also heard some really great input around how do we support teens and young adults in learning about healthy relationships and all the things that go into, that critical part of your life where you start having to be an adult. Like, how do we help people move into that? And then the last one here is around helping or making sure that people feel safe and connected to their community. This first strategy got a ton of support, and it's really around investing in community coalitions that can really address domestic violence, sexual assault, and child abuse in ways that are very culturally relevant and appropriate. And that strategy actually came right out of our state's domestic violence plan, and it's also one that's being tracked through Healthy Alaskans. So it's got a lot of support. Victim advocacy and case management. Here again, you see that same focus on navigation and case management. As I mentioned earlier, the Alaska Reentry Program got a lot of support. This fourth one is around making sure that APD can be fully staffed, and also that their staff really reflect and represent the community that they're serving. And so finding ways that APD can work with community organizations to really attract and retain great officers. And then the other one here is what we heard. This is a very specific one. We heard from some of the housing organizations, but just that when we have meth use happening in housing, it's really, really expensive to mitigate that. And so figuring out ways to intervene earlier and reduce that, because the amount of money that's being spent to mitigate that in units is money we're not spending to expand housing. And then the last things on here are really around more community engagement. So how do we get kind of outdoor and indoor spaces activated? How do we help businesses keep storefronts and streets safe and healthy, and kind of do that sort of violence prevention work? So that's a real quick rundown of what's in the what.
All right, Karen.
Before we get done, I was looking at the survey results at the end, and if you addressed this, I missed it, but was the transparency question added after the survey went out? Because there's no survey results on those questions. So I'm looking at page 36 and 37. Like on page 36, education had 299 respondents on the survey, but if you go down to the transparency, there's no numbers there.
You're saying there were no, sorry.
Well, it looks like there's, so if you look at the survey column on this page, all the other categories, there's like 232, 238, 247, and then there's just a little line, little dash on the transparency questions. Am I just not?
No, I
reading it
hear what
right?
you're saying.
I'm wondering if that question got added after you did the survey?
No, I think the transparency questions weren't on the online survey. They were
That's-
asked on the posters, but they weren't on the online
Oh,
surveys.
gotcha.
Yeah.
Okay, thanks.
And then in the end, we did have a bit of a confusing, like, two sets of goals. And in the end, we realized that a lot of the things that were under transparency just needed to go into that how section, and they're not really ranked because they're kind of all important. So those parts were on the posters that we showed, but they weren't necessarily part of the survey. I think I'm right about that.
Yeah.
Yeah.
Okay, we are at the end of our time. We will convene back at 1:15 for the second part of our conversation today. This will be on the ACE Fund. Thank you, and we'll review and digest and then see what we do with this roadmap. Adjourned.